and also because I think I figured some stuff out. Some of this I'm translating into a course for PhD students, and ultimately I'm trying to write a book about it as well. And there's a lot to talk about, but given how little time we have, I'm only going to cover a few items here. First, my path. This is not me. Looks like me. I have a similar wardrobe. So cast your mind back to February, March of 2020 when the pandemic was just starting and rumors of lockdowns were starting. My wife was pregnant. I was on paternity leave. I wasn't thinking about this disease. And one night I stayed up to do some disease modeling, and I discovered, much to my horror, that this COVID-19 would last years, not the weeks that the media was currently assuming. And this horrified me because it occurred to me that my elderly parents might never get a chance to meet their incoming grandson. Um, and I didn't know what to do about it. So my spouse found me like this the next morning, literally in the fetal position, because the world had not yet woken up to the fact that this was going to be a years long endeavor. And I asked myself, what will my son ask of me one day? Saying, Dad, you're an epidemiologist. What did you do in the great pandemic of 2020? And I realized I'm not a famous infectious disease modeler, but I am as a pretty good communicator, I think. So I decided to write a blog post. And my blog post was this: COVID-19 was the end game, which I outlined what herd immunity looks like and why we're doing certain things in lay language. My blog gets about 200 readers per week. This one got 500,000 readers in 1 week. And it occurred to me that, oh my goodness, there is a thirst for somewhat supposed authoritative commentary on this pandemic. Public health communication is in a crisis because no one is answering the public's concerns in lay language sufficiently. So as a result, the media started calling. And over the next few years, I did well over 2,000 media engagements. It's over 3,000 now. I stopped counting at 2,000. And since then, I've consulted on a series of lawsuits. I've advised media and drug companies, et cetera, all on communication of the pandemic. And I've answered hundreds of random questions from the public. And I got a lot of hate mail and a lot of threats, but a lot more emails of gratitude. And we have to remember that the positive greatly outweighs the negative. We tend to focus on the negative, but the positive is real. And we're going to take steps to learn about how to diminish the negative. But remember, the majority of people do appreciate good quality, supposedly good quality public health communication. It has been exhausting. And one of my concerns is how we teach the next generation of epidemiologists and health scientists about public engagement, protecting themselves. We can have a conversation about what that looks like as well. I always start these presentations with a quote from this paper from 2007, which was written in the wake of the SARS epidemic. And this paper landed on 3 recommendations for pandemic management. The third was that animal husbandry is bad for human health. That's part of my vegan propaganda. Put that aside for now. The second is that the old technologies work, the new technologies are questionable. Old technologies are wearing masks, hiding in your house, avoiding people. And the first one is transparency is the best policy. And that's what we're going to talk about a little bit now, is how we communicate was proven in the SARS epidemic to be critical in how we manage people's expectations and behaviors. And we kind of dropped the ball a little bit, I think, in the COVID-19 pandemic for a lot of reasons. What I'm going to present you the next couple of slides comes from a book we have coming out soon. By we, I mean my colleagues, Colleen, Brandon, Sam, Sophie, and others, a book called Pandemics, Public Health, and the Regulation of Borders. And go out and buy a copy. I don't get royalties, but looks good on the resume. So let's talk about what the role of public communication in a public health emergency is. And there is no consensus about what that role is. But I think they are arguably at least 5-fold. First is to tell people what we're concerned about, what the emergency is. Second is to tell them what the steps we're taking, we meaning those empowered with responding to an emergency, what the steps we're taking to respond. Third is to keep them informed about the key developments. Fourth is explain the science. This has proven to be a big one. And lastly, to help assuage panic. And this one, I'm not entirely sure about because this has something to do with message management. Sometimes it is appropriate to panic. Who am I to decide when panic is right and when it isn't? But what about changing behavior? Is that a goal of public health communication? I would argue that it probably shouldn't be. And in the past, it has been. And during COVID, we had lots of conversations with policymakers about how do we change behavior. The problem with having as a goal the changing of behavior is that it compromises public trust. So on the one hand, we have transparency of providing information, which is critical. On the other hand, we have a desire for people to use that information in such a way that is conducive to our ultimate public health goals. When people see that that is your agenda, that will compromise trust somewhat. Let's cast our minds back to the anti-smoking campaigns of past decades. We did our best as public health people. We flooded the airwaves, the culture, with the appropriate information that smoking is bad. Smoking is associated with all kinds of horrible outcomes, including cancer and death and other kinds of bad disease. And that still wasn't enough for an intractable fragment of the population that still continued to smoke despite knowing all this. As a result, we started rolling out these images on cigarette packaging, these horrific images of diseased lungs and dead people. So at what point do we say that this is no longer about informing the public and more about compelling them toward a certain action? And the tobacco companies, I think, rightfully push back by saying, look, what are you doing here? People know this already. What are you trying to accomplish? And the data is unclear about whether or not this kind of extreme imaging actually has some kind of effect. So the point I'm trying to make here is at a certain point, we have to ask ourselves, what are we doing? Why don't we just make smoking illegal? Right? So that's a debate that continues on here. And other ways of compromising public confidence in your messaging is to be intentionally imprecise.
Oh,
I've
Dr. Deonandan,
Yeah, there some reason I
okay,
went
we
mute
can
for
hear
some
you.
reason. That's odd.
Yes.
So the
Okay.
example I'm going to give you now is elaborated on a paper I published last year called Imprecision and Conscious Moralism in Public Health. And it gives a couple of examples of when public health communication, in my opinion, overstepped its mandate. Here's one. This is an ad in the subways of Toronto. It says, did you know that 86% of HIV positive Canadians are male? 2/3 of boys aged 15 to 19 are sexually active. Don't think your kids are at risk. Think again. This is an emotionally inciting ad. It suggests that your child, your boy in particular here, has a very high risk of getting HIV. And the reason you think that is 86% is a high number. The problem here, of course, that 86% is not the risk of getting HIV. That's a distribution, not a risk. The prevalence of HIV amongst Canadian male youth at the time of this ad was up in the subways was like 0.03%. The incidence rate is less than that. That's a low risk. The 86% number is not a risk measurement. Now, I'm not saying one should run out and have unprotected sex. I'm not saying that at all. I'm saying that there was an intent here to misrepresent the level of risk to compel behavior. And this ultimately breeds distrust. Another example, this is from Ernestine's Women's Shelter in 2011. 3 to 5 children in every classroom have witnessed their mother being assaulted. 70% of men in court-ordered treatment for domestic violence saw it as a child. The implication, of course, is that if you witness abuse as a child, you have a high probability of becoming an abuser yourself. The problem is that 70% number is not a risk, it's a distribution. And this ad offers no insight into the proportion of children who witnessed abuse who go on to become abusers. And at least one commenter has called this kind of advertising problematic because it can result in victim blaming when these individuals very often do not go on to become abusers. The intention is good, but the way that it went about communicating breeds distrust. The lesson here is public health messaging and communication is well-intentioned, but it has a history of presenting statistics in a dishonest fashion in some cases, not all cases. And this, of course, breeds distrust, and it sets the table for the emergence of an entire industry dedicated to undermining our credibility. And that's exactly what we saw with the COVID pandemic. So the pandemic came, and pandemics have a history of exacerbating the existing cracks in society. And these cracks can be ideological, left versus right. They can be socioeconomic, poor versus rich. They can be ethnic. In this pandemic, I would argue, is the ideological divide that was mostly prized apart. These certainly happened. And pandemics reveal the vulnerabilities in our communities. And we saw individual relationships fragment as well as people interpreted communication differently along their ideological lines. As a result, emotions are raw. Everyone feels attacked on both sides of the argument, and it's really dangerous for a communicator out there to be tiptoeing through this kind of messaging. I'm a fan of Neil deGrasse Tyson. If you don't know who that is, he's a famous astrophysicist. He is uh, he's he's often calling upon scientists like us to be more accessible to the general public. He says, if you're in a pub, announce who you are, because probably no one is ever going to have a chance to meet a scientist in real life, and maybe they've got questions. And that's true. The problem is it works for him because he's an astrophysicist, and no one's identity or ideology is shaped by what happens beyond the event horizon of a black hole. You can have a dispassionate, safe, and comfortable conversation in a pub with somebody about these things that don't have an immediate impact on your life. Now, let's not talk about flat eartherism. That's another story entirely. When you're in the health sciences, however, everybody has a card to play. Everybody has a stake in the game. Everybody has an experience in the hospital with a doctor or a personal anecdote to offer. As a result, it's a bit more problematic for health scientists to be engaging with the public because everyone's got an opinion. And that brings us to some disturbing statistics. Sorry about this, where more and more people feel it is justified to harass and threaten public health officials. This number went up during the pandemic. This is just one statistic. I have a bunch of other ones to look at where people not only do the threatening, they think it's justified to do so. Again, because of a history of distrust and of ideological purveyors of bad information and divisions in society allowing this to happen. That leads us to this wonderful quote that I love. COVID-19 is a case study in the interplay between contagion, information, misinformation, and behavior. And ultimately, what this is all about is behavior. So for the remainder of today, I want to talk about four things that I think have complicated the COVID communication crisis. And there are a lot more than four, but there are four that I've got time to talk about today. The first is disinformation. Now, disinformation is different from misinformation. Misinformation is getting things wrong. Disinformation is intentionally getting things wrong for a political outcome. And there are three cognitive biases I want to talk about. First is how we are genetically incapable of understanding exponential growth. You don't feel exponential growth. As a result, you must depend on the data to explain it to you. And a lot of people just aren't capable of allowing data to tell a story. Second is the inability of many people or the refusal to distinguish between individual risk and population risk. And lastly, our ingrained inability to understand uncertainty unless you're trained in statistics and probability. So first, disinformation. This is a tweet from CSIS, and they said disinformation about COVID-19, excuse me, is being spread by threat actors to discredit government efforts. Okay. This is obvious to many of us. It's still shocking for many in the public to hear that a lot of the disinformation that we hear about vaccines, about COVID, are intentionally produced by foreign agents for the purposes of sowing discord among our population. Here is an analysis from the RAND Corporation. They find that during the COVID pandemic, certain foreign governments, in particular Russia and China, according to their analysis, were engaged in sowing this disinformation. And the first point here, Russian media advanced anti-US conspiracy theories about the virus. I'm not a geopolitical expert. I don't know why this is happening or precisely who's doing it. Some of the theories that have been put forth involve general sowing of discontent in your political opponent, and also making the West's vaccines seem distrustful, and therefore elevating the platform and quality, at least in perception, of the Russian and Chinese vaccines. So all kinds of motivations at play here. The disinformation campaigns have weaponized social media, and social media is definitely the battleground of public health communication now. And the textbooks didn't prepare us for this. What textbooks do exist? Any kind of training that epidemiologists or public health officials got in communication did not really prepare us for waging war on the battleground of social media. And science by YouTube and by meme. Who's got a degree in memes? Nobody, right? This is all new. We're learning on the fly. And yeah. uh, our supposed political antagonists are better at it than us. There are well-funded disinformation machines that produce memes, that produce troll accounts and bot accounts on Twitter and other platforms for the purposes of spreading um, these memes that we see taken up by unwitting individuals verbatim, who then spread it amongst genuine human social networks. Here is a report from the US State Department, and they have listed exactly how foreign powers have spread COVID disinformation. Among them, direct funding of a handful of writers who push these false narratives. Second, using fake profiles on Facebook and Twitter. And investigation found that these fake profiles are actually linked to high-ranking Russian military officers. Proxy websites, Newsfront, Southfront are just two of them. These look like actual news organizations, but they're not. And so people unwittingly share these fake news stories. This is an old ploy, by the way. It's been done at least as far back as the 70s around climate change, denialism, where I won't name the name of the publications, but prominent anti-science publications would produce climate denial stuff and dress it up like a peer-reviewed journal article, even though it's an op-ed. And that gets shared by unwitting individuals as peer-reviewed science, but it isn't. And lastly, bots amplifying fringe positions. So we definitely see this, continue to see it all the time. Many of us are on guard all the time for blocking the bots. I had an experiment on Twitter recently where I tweeted a bunch of stuff about vaccines, about COVID, about cryptocurrency to see how long it would take to be spammed by a bunch of bots. Didn't take long ago. Then when Russia invaded Ukraine, that was a natural experiment to see exactly how real this was. And sure enough, these same bot accounts that were pumping out anti-vax and COVID minimalization rhetoric suddenly pivoted to pushing pro-Russia propaganda in the wake of the war. Early in the Russian invasion of Ukraine, Twitter banned accounts originating from that part of the world, and instantaneously, the sun came out for public health communicators. Our level of harassment and attack diminished to near zero. It was very telling. And it tells us that we do have policy levers to help us along this path. And then when those bans were lifted, the abuse came right back again. But it's not just foreign agents who are doing this. There are local agents with other kinds of agendas. So here's an article from the Washington Post. The Koch brothers are a hyper-conservative family that fund far right-wing political movements. Koch-backed group fuels opposition to school mask mandates, etc. So they're well-funded, they're well-organized, and we, meaning those of us who argue for public health measures, are not as organized or as funded. Here we have anti-vaccine groups on Facebook. We're spreading distrust in the COVID vaccine well before we had a COVID vaccine. Again, the level of organization is astounding. The wall up against which we as public health communicators must climb and fight is astoundingly high and thick and well-funded. So the challenge of social media as a battleground is complicated. Very often, the anti-vax messaging is, again, well-organized, dressed up so well. They produce YouTube videos that are so slick, often involving actors dressed in lab coats and stethoscopes to give that appearance of medical credibility. And these YouTube clips reach millions of people in minutes, getting all kinds of likes, thus feeding the grift of producing income for these individuals. And what is science's approach in response? We produce a peer-reviewed paper that gets read by 2 people. That is actually the average number of people that read a peer-reviewed article, according to one study, not including the authors. Millions versus 2. And peer review takes months. So we're always at a disadvantage when we are producing rigorous scientific response to misinformation that is produced or disinformation that is produced in a matter of seconds. The second point is the cognitive bias of misunderstanding of exponential growth. And Albert Bartlett had said that the greatest shortcoming of the human race is our inability to understand exponential function. And I'm fond of saying, asking people, how long do you think it would take if you invested $1 in an account that doubles your money every 3 days? How long would it take to be a millionaire? And the answer is not that long, a matter of weeks, not a matter of years. So exponential growth is astoundingly powerful. Those in finance understand it, but nobody else really does. I wrote this article for the Ottawa Citizen back in 2021, where I pointed out that a particular Ontario government representative, it was Sylvia Jones back then. She wasn't Minister of Health. She was had another role, but she was asked in a media interview why the government hadn't yet responded to hospitals' requests for more interventions to prevent the incoming wave of extraordinarily high number of COVID cases. And she said she wanted to make sure that the modeling was actually showing up in our hospitals. And this underlines a profound misunderstanding of exponential growth. By the time you see it, it's already here. It's already too late. The curve has surpassed you. The human animal is not genetically predisposed to understanding exponential growth. It's not something we encounter in our evolutionary heritage. Therefore, we have to rely upon the data to explain it to us. Other papers have been written about this. Here's one from a German scholar, 2020. People mistakenly perceive the coronavirus to grow in a linear manner, underestimating its potential for exponential growth. And this influences political opinions about matters of life and death. The next cognitive bias I want to talk about is our inability to distinguish between individual and population risk. So population risk is the number of deaths, in this case, caused by some kind of hazard. And individual risk is the incremental probability that hazard gives on an individual person. And this definition is from that article here. The problem is people really don't understand population risk. We understand individual risk, especially in the West, because we're an individualistic society. So the transposition of what it means, what a disease means to public health is misunderstood about what it means for an individual. And this, by the way, I think also implies that evidence-based medicine is not a relevant framework for population level emergencies. You can't do a series of randomized controlled trials for every single possible intervention. We haven't got the time or the money to make that happen. You can't do a randomized controlled trial for mask wearing when we have to implement the mask mandate now. We can't wait 6 months to see the data coming through. This also has implications for the base rate fallacy. So there's a question here. Will a recording be made available? My understanding is yes, there will be a recording of this later on. So base rate fallacy, if you don't know, is this tendency of people to look at the distribution, but not the rate. So here's an example of the number of hospitalized people who were vaccinated versus those who are unvaccinated. Now, according to this graphic here, the vaccinated people outnumber the unvaccinated. And people send me this kind of data all the time saying, look, all the people in the hospitals have been vaccinated. Clearly, the vaccines don't work, except that proportion of people in the hospital who are vaccinated as a fraction of the total vaccinated population is minuscule versus the unvaccinated, which is not minuscule. So it's the rates that people don't understand, and rates are risk. So that's an example of this inability to appreciate population versus individual risk. A bigger example is the IFR, infection fatality ratio. So that means of all people who get COVID prior to vaccination, about 1% would die. This is the consensus IFR for COVID. As a result, a lot of people were tweeting things like, who's afraid of a disease with a 99% survival rate? At an individual level, that sounds compelling. Like, I'm not afraid of something that has a 1% chance of killing me. When in actuality, you should be terrified of something that has a 1% chance of killing you. If crossing your street had a 1% chance of killing you, how many times would you have to cross before you started getting nervous? Right? In Toronto, on a given morning, 1 million people are commuting to work. If that had a 1% chance of killing you, that's 10,000 people dying every morning in Toronto. That's an astounding amount of death. This is the population level analysis. This is the individual level analysis. IFR is about populations. So many people cannot do the cognitive transposition between these two concepts. And yet, a lot of the messaging has been focused on individual risk, not population risk. For example, the CDC website, getting a COVID vaccine is a safer, more reliable way, blah, 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 all the individual risk. Government of Canada website, by triggering more antibodies, a booster dose can improve your chances against, all about what it means for you, but not an individual. So the messaging around the positive community impacts of vaccination or mask wearing, very rare. We almost don't even try to do it. Now, is that intentional? Is that a result of a belief that maybe people won't respond to population level messaging? Possibly, possibly that's the case. But the point I'm making here is that there is a distinction between population level and individual level risk measurement, and we need to make that clear to people. The last bias I want to talk about here is our discomfort with uncertainty. So this paper here suggests that consumption of any sort of messaging with uncertainty about COVID-19 produces traumatic stress in people, measurable psychological stress, which is interesting. And this author here, Christopher Reddy, in this book, suggests that people don't understand how science works. They don't understand that uncertainty is baked into science. We are certain about nothing. I tweeted earlier this week about a date I once had with a girl many, many years ago, where I told her, I don't assign 100% probability to anything. I'm not entirely certain that the sun will rise in the sky tomorrow. It's not 100%. I'm mostly certain, but it's not 100%. And there was no second date because people don't appreciate that level of uncertainty. The point is, science is riddled with uncertainty, right? Vaccines aren't 100% effective. They're mostly effective. We're not entirely certain if the mask will prevent you from getting infected. We're mostly confident, right? So people want guarantees, and I had a lot of hate mail and tweets directed at me by people who wanted guarantees all the time. And when I told them I cannot give you guarantees, they got even more upset with me. So the two kinds of uncertainty really that come to play here. The first is an inability to appreciate probability. So for example, if I say the current COVID vaccine has a 60 to 70% efficacy against hospitalization, which it does, the new booster actually does have that level of effectiveness. Someone on social media is going to tell me, as they have, but my uncle was jabbed and he's in the ICU right now. Clearly it doesn't work. Yeah, because 60% is not 100%. Yeah, and this kind of reasoning takes a long time for many people to appreciate. And people are uncertain about what science actually means. And this leads us to discussing the kind of science education we need to invest in. I'm fond of saying that I want this added to the end of every long form COVID missive. All of this is true until further notice. I reserve the right to be wrong and to change my mind as more data come in. That is science. And public health is making decisions based upon what evidence you currently have. It may not be the best evidence, it may not be perfect evidence, but we got to act now. Okay. So people have to understand that this is an evolving situation with evolving information. Related to this is the inability to appreciate abstract data. So someone sent me this great example. Some people will not wear a seatbelt on their drive to the beach, but they're terrified of shark attacks when they get there. Shark attacks, exceedingly low probability. Dying of a car accident because you're not wearing a seatbelt, relatively high probability. And yet shark attacks are sexy and viscerally terrifying. So that's what's going to trigger people. A car accident is not as sexy or as inciting. I have endless examples of this in my personal life where people just cannot appreciate genuine risk from emotionally inciting risk. Then we have medical professionals amplifying misinformation, and usually this is unconsciously. So there are many, many cases I know of doctors telling their patients they don't need the new COVID vaccine because they are individually of low risk and therefore they shouldn't worry about it. And that might be true for many individuals. They're of low risk. But again, there is a role for medical professionals to talk not just about individual risk, but about population risk. But the way we train doctors is to focus on individuals, not on the public health or on population health. And this is a problem. What should we do? Well, I think we have to reinvest in science literacy for everybody. We have to reinvest in numeracy, risk appreciation, as I mentioned, and civics. Like we have a responsibility to care for each other and to keep society running. We have to rebuild trust and expertise. How? I have no idea. It's going to take generations. And we have to set aside resources for public health communication. Why? Because those of us who've been doing this are doing this in our free time. We don't get paid for it. It's not part of our job description. Um, but many of us have become the go-to when the public has questions about these matters. They don't go to the government. They don't go to websites produced by public health or universities. They go to individuals of somewhat high standing and reputation. We have to be proactive with corrective information. We can't wait for the YouTube clip to be posted saying nonsense for us to respond with a couple of tweets that no one's going to read. We've got to be creating our own content with proper information so that that's ahead of the game. That's the baseline. People begin with truth, and it is incumbent upon the disinformation merchants to dislodge that truth, not the other way around. And we have to appreciate that maybe Michel Foucault was right when he said the universe is not made of atoms, but of narratives. People are not compelled by data, they're compelled by stories. I can post endless numbers of graphs showing vaccine efficacy, but that's toppled by a single story somebody has of a vaccine injury. Right? So data does not move people or policy for that matter. Opinions and stories and narratives do, unfortunately. And I think what we're going to have to do in future crises is to find charismatic, authoritative people to be the faces of the public health campaign. Who is that person? I don't know. It's not me. But people respond better to personalities. I think Germany had a better success with their public health communication because they had Christian Drosten front and center doing almost all the communication. He was one man with authority. He was a senior virologist with some influence with the government. And he had a personal blog and a podcast. He was accessible. He spoke in relatable language. He admitted when he was wrong. He got a lot of threats too. It wasn't easy for him, but he was the face of it. Now, the USA had Fauci, and he ended up being the target of an enormous campaign of hate. And I don't know how successful that was. But we didn't have that in Canada. And maybe we need a cadre of individuals who are real people, who are recognizable with names that people can actually appreciate. So in conclusion, what we've had these past few years is a crisis of trust, which was building for a while. And it was fed by the ideological divides that were already present in the era of Trump and other kinds of ideological crises affecting the Western world. It's going to take years, maybe generations to build it back, but we have to start now. And we have to begin with transparency and honesty. I really don't like it when we have public health messaging that is sly and trying to subvert individual choice by presenting data in a tricky way. Be transparent with the data and with what your intention is. And we've got to have some faith that people ultimately will see it your way, and maybe some won't, but many will. And lastly, we have to invest in science literacy and numeracy. That will take generations to fix, but it must start now. Those are all my slides, people, and I want to have a conversation with you. Questions, please. Otherwise, Joe, the miraculous Dr. Joe Vipon has a question.
Yeah, first of all, I want to start by apologizing for objectifying your hair in the chat.
It's
But I am
offended.
a contributor to that. But no, excellent talk, and I think the my admiration for your work is incredible. You are one of those charismatic, honest leaders that have been really important throughout the pandemic, and of course I use that very much in the present term. Recently, I had a kind of offline debate with a famous debunker, the amazing Tim Caulfield, about this idea of misinformation and disinformation, and the fact that there was so much erroneous information coming from public health in particular, like, well, I wouldn't say in particular, like essentially all of our chief medical officers of health speaking about how schools are safe, the kids don't spread COVID, that COVID's not airborne. I mean, I could go on and on and on and on. The lack of mentioning of long COVID in any missives, despite the deep knowledge on that within the public health community. And I don't know if maybe it's just semantics, whether it's misinformation or disinformation. But I guess as someone who thinks we're still in it, and we still have a a long ways to go to get out of it. I do think it's maybe important to dissect that, because we still seem to be making a lot of the same errors. And I just wondered if you wanted to comment on that, since you had a big section of your talk on that.
Yeah, that's actually a really good point. The role of public health in spreading misinformation and how much of this is actually disinformation. I'll tell you a quick anecdote. Part of my career in advising and lawsuits involved having to testify in a courtroom about airborne transmission because the lawyers I was representing wanted to move a certain murder trial online for fear of infecting their vulnerable team. So when I was testifying that COVID is airborne, the other side sent their expert to testify that COVID is not airborne, and their expert was from Public Health Ontario. And that was the official position of Public Health Ontario, that there is insufficient evidence that COVID is airborne, but there was astounding amounts of evidence that COVID was airborne. So is it a case of them being wrong? Is it a case of them being deliberately obtuse? Is it a case of a cultural difference? And I think it's all of them, to be honest. I think some individuals were deliberately obtuse, but I think it takes, some institutions are slower than others. Government institutions are famously slow. And by slow, I mean slow to adopt and appreciate and inculcate new data into their policies and practices. There's also something to be said for the medical establishment. Something that's based on clinical care is not necessarily going to appreciate the qualities of evidence beyond EBM. And this is something I'm going to harp on a lot about. Yeah, the strongest clinical evidence was not present for airborne transmission yet at that time. But why are we relying upon clinical evidence? At that point, laboratory evidence was sufficient to sell the story. So the inability to appreciate the pyramids of evidence are different in different contexts, I think, is what really complicates public health response on this matter, because public health is still seated in a strongly medical dynamic and paradigm, and it probably shouldn't be. It should be sitting in a larger scientific paradigm. I hope that answer makes sense, despite the verbiage of garbage that I spewed.
I'll just say one more quick thing. And I know there's other questions. I kind of got the sense that maybe the reason why we don't qualify it as disinformation is because they're on our side.
Right.
So if it's disinformation, if it's from China and Russia, maybe it's not a disinformation, it's from Public Health Ontario or the WHO.
Yeah,
Anyway,
I think there's something to be said for intent as well. And maybe I'm being naive here. I like to think that their intent is not to slow down response. I'd rather think that they're just misinformed by virtue of their scientific paradigm. I could be wrong. If there is actually intent to foment bad behavior, then it is disinformation. Absolutely. Franco, you're up next. Thank you.
Hi, excellent presentation. So I just wanted to get your opinion when you're talking about, there's this well-oiled machine that's out there to, to undermine and to spread false information. I'd like to know your thoughts. Is it better to kind of ignore this bully, or do we need to educate against that? And maybe at the risk of saying, well, here we are finger pointing the government or whoever, the authorities are not comfortable there. So it's a question of he said, she said, versus, like you're saying, let's just, because it's unfortunate that two people read, the real publication when the meme that's out on TikTok and millions can see it, right? So
yeah. Well, if we're talking solely about, foreign disinformation agents, I fully appreciate, we don't want to stigmatize individuals from those countries. It's not their doing, it's their state's doing. There's a role here for our state to respond. In many ways, responding to foreign disinformation is actually easier than anything else. As we learned when Twitter shut down those accounts for a short period of time, we can actually shut down those accounts or stop them from penetrating our social media networks. But what we can do passively, if our state isn't willing to do that on our behalf, is that, you're correct, is just flood the waves with that bit of perspective that this is all originating from these server farms in Belarus. Now, will that be successful? Probably not, to be honest. It's so well inculcated in the misinformation subculture that we're not going to win at this point. We actually do need state help, I think. Just looking at the rate at which the bots poison and infect the verbiage of real people online in a matter of seconds. I think we need state help in doing so. Yeah.
Okay, thank
Yeah.
you.
Thank you so much, Pat. Franco. Yeah. Do you have a question or comment?
Yeah, first of all, great presentation. I'm coming from a regulatory perspective, but also from a perspective that I'm a father of two young children. So from a regulatory perspective, just a comment, really hard to prove disinformation. It gets into this legal sphere, and to actually go down that path, and my experience with that has been really difficult. So we typically stick with misinformation. From a parent perspective, I really enjoyed the mention about the balance between trust and changing behavior. And with my children, when it comes to science literacy, I'm really pushing them to fact check. Because I mean, Raywat, I can find a video of you probably existing now where it's not you, it's a deep fake, and it's you telling us all sorts of wonderful things. And it's really important for not only us, but the next generation to not only fact check what they're reading, but also fact check what they're seeing in the scientific domain. So just curious to know what your opinion is in terms of how do you embody that type of fact check mindset at every single level? So not just children, but in adults like ourselves.
My first thought is I really look forward to my impending deep fake porn career. That's going to be interesting. But this information definition is curious. I think you're right. You can't prove it, so you're probably better off not using it. Except by definition, I think disinformation has an intent behind it. You can't prove intent. You kind of know when it's there. But your question is, how do we embody trust? Was that the question essentially?
It's really from the science perspective, because one of your solutions is just look at science literacy, and I support that.
Yeah.
But my question is, within that umbrella,
Yeah.
is it also giving tools and training on how to fact check?
Yes. Yes. So not just fact check. This is a dangerous topic, actually. I saw a stat recently that the fastest growing high school topic in the US right now is media literacy, which is exciting. Except I do wonder how it's being taught. If it's taught as trust nothing, question everything, well, that's not good. That just leads to conspiracy thinking. If it's taught as here are the tools for critical evaluation of information, well, that's more useful. That's hard. It's hard for me to teach that to our undergrads and grad students, as you know, let alone to the general public at the high school or younger level. But that's what we have to do. Most people default to, hey, this author used to work for that company, therefore we can't be trusted. Like follow the money. Follow the money, in my opinion, is the lowest level of critical evaluation. It's something deeper about what is the quality of the design of this study? What is the credibility of the organization pushing this bit of information? For example, recently, Brett Weinstein, a famous vaccine denier, has been publicizing a claim that the COVID vaccines have killed, was it 17 million people? And this statistic was computed by Denis Rancourt, who is a former professor at this university, who left under shadowy conditions. The paper itself, I've read it. It's not peer reviewed. It's essentially published in a blog, someone's website. I find the analysis to be laughably bad, childishly bad. It makes some basic errors, like it's what we call the ecological analysis that claims to be causal, but by definition, ecological analyses cannot be causal. It should be so easily dismissed by the most fundamental level of critical thinking, and yet it isn't, because people's desire for it to be true, if that adheres to your agenda, is so great. It allows them to overlook these flaws. So the question becomes, how do we train people to think critically despite their underlying agenda? That's a psychological question. That's not so much teaching science. That's teaching psychology and mental discipline. So I think what I'm talking about here is a complete reworking of our education system to teach psychological discipline, sadly. Jennifer, question, comment?
First of all, thank you so much for this. I thoroughly enjoyed listening to you. Maybe an unfair question. If you were to be able to provide all the public health leaders with a couple of speaking points that you feel would be most effective for getting us out of this spot that we're in right now, either connected or not connected to any modeling you've done for the next few years, what would you say?
Wow, that is not a small question at all.
Oh.
My first first analysis, my first attempt at this, to get us out right now. First is start producing content. Start producing a lot of content for mass consumption, meaning it must be understood by the masses in the form of YouTube videos, TikTok videos, tweets, whatever it might be. Not in government speak. Oh my God, am I tired of the standard government infographics that no one looks at? And now, if you distrust government in the first place, you're going to dismiss that right away. If it's got the branding of the government of Canada on it, the people who need to look at it are going to just throw it out. You need to hire some influencers to do this properly. You need to get a team of good scientists who are somewhat trusted, somewhat. I mean, not everyone's contaminated now to some extent. To get on board with this project, and I will nominate Tara Moriarty from U of T to do this because she is so good at this sort of thing, and start flooding the airways with that kind of information. Next is, in addition to the information, teach cognitive biases, so that those people who might be reachable can be reached with a little bit of introspection. There's going to be an intractable group we cannot reach. They've been consumed by the forces of evil who are preying upon their vulnerabilities and fears. And they're deep into Mordor right now, and I'm not sure that we can throw away the ring in time to save them. But for those who are on the fringe of understanding, I think we need to encourage them to question the cognitive biases. And I think a campaign to allow us to do so would be quite useful. Things like, hey, this is how you do a critical appraisal of a paper. This is how you question your assumptions about how you interpret this bit of data. Again, I haven't fully thought out this process because you just thrown this question at me. It's a fantastic question. I kind of want to write a paper about this now. But do you have ideas you want to offer? I think maybe in the audience people have ideas. I think it's a really good question.
I love what you're saying. I think that one of the things I'm hearing is really reach people with the things that are reaching them, unfortunately, with massive misinformation. And I think that's brilliant. And I'd be delighted to chat with you about it offline sometime.
Sure, yeah. And again, to essentially repeat what I said to Yad, I think what we're looking at here is a fundamental rewiring of how we engage with people and train people around thinking. Somehow we have stopped teaching people how to think. And it's coming home to roost now. And it sounds arrogant for me to say so because the underlying assumption there is I know how to think, and maybe I don't, right? But I mean, I think I do. Maybe I'm wrong. Question from Erling. Thank you so much, Jennifer. Erling Rudd.
Here, hey, Raywat.
Hey.
It's sort of as I was listening to you and thinking about the initial SARS in Toronto and the lessons learned that we got from SARS, and then I was sort of listening to your discussions of COVID, and I was going, I've gone back so many years. It's the same lessons again. The communications issue, the consistent messaging. Initially with SARS, you saw messaging coming from so many different directions that obviously the general public would not know who to trust, and obviously didn't trust anyone. And in COVID, we had the same problem. So I liked your comment about Germany and the fact that you had, a fairly dominant individual who could respond consistently to the approach. And I'm sort of wondering if we need to have a school of individuals like that in this country who can respond to a situation. A virologist when you need a virologist, or bacteriologist, or name it. But individuals you can go to fairly quickly to be giving those messages so that it is consistent.
It's a good idea, and I've actually had offline conversations with individuals who propose similar things as branches of government. The problem, of course, is who's going to volunteer for that, given the way we've all been treated these last few years. I've got grad students who early on in 2020 were so excited to be engaging with the public to help what they can. Quickly, when they saw how I was being treated, they backed away and said, nope, I want none of this. And there's a crisis in producing a new generation of public health communicators because nobody wants to be in the public eye. So how do these people get remunerated? How will they be protected? But there are ways. Absolutely, there are ways to do this.
Maybe there could be a chair approach, so creating chairs. Yeah.
Totally, yeah. I mean, I'm a little bit sympathetic to government, to be honest. When COVID happened, they got caught with their pants down, insufficient resources. They're running around trying to get tests, running around trying to, get the masks out of storage. they're undermanned, understaffed rather. So who's got time to manage a communications campaign, right? Here we are almost 5 years later, though, and you'd think that would have been addressed by now, but there's actually fewer resources now than before. That's the problem. All comes down to resources, frankly. But interesting idea. I'll give that some more thought. We should talk about it together offline.
Yeah, thanks very much.
Thank you.
I just want to quickly chime in. There are some very nice comments in the chat as well, but there's also a question. So there's a question, I can read it out.
Sure, please do.
The idea of pyramids of evidence is really interesting, and who the public should be looking to inform them, make recommendations, and take action. Can you speak to your thoughts on the role or requirements? So this can be legal, moral, ethical, of educational institutions to inform and protect the communities they serve, especially
wow,
in the
that is
face
a
of
big question. Oh my goodness. Yeah, education institutions are critical. Early on in the pandemic, people were asking me who people should go to for good information. And I said government websites were not reliable back then. They were being updated very, very infrequently. The universities were doing the best job. In particular, Johns Hopkins was heroic, frankly. I think the role of universities should be just that, to be transparent, mostly impartial sources of data. The government data sets, they're great up to a certain point. They're not well maintained, and the sites are not easily navigable. There's a couple of sites, for example, that were producing, when you typed in the queries, were giving you the opposite to what you're expecting for vaccine efficacy. They're showing that vaccinated people are more likely to be infected, which is not true. It's because there's a coding issue in the back, and it took government months to fix that coding issue. I'm not going to tell you which government it was, whereas universities can be a bit more labile and responsive on that front and increase their profile as a result. Right now, universities are struggling to find purchase again and relevance in the world. Frankly, there's a crisis in universities. I think we all know that on this call. Being a source of public confidence and information, rather, would be a way to reinvigorate the role of university in society. I think that's the major thing to look at. And also, to get it back to the pyramids of evidence, universities as homes to different kinds of inquiry can also be homes to the processing of hierarchy of evidence within each domain. Right? Here is the best kind of evidence for a clinical question. Here's the best kind of evidence for an emergency public health question. Here's the best kind of evidence for an engineering question. Here's the best kind of evidence for a social sciences question, and the processes by which we come to that conclusion. The opportunity for public engagement and education has never been greater. And I think we really have to jump at that opportunity now. Good question. I like it. Yeah. I think Joe had his hand up again.
Well, I just noticed there were no other hands, and I just had one other thing I wanted to talk about, and that was about accountability. There have been lots of errors made in this pandemic by people in positions of power. Very few people have been demoted, very few public censures. Mostly the same people who've made the bad decisions continue to be in those positions. And I just I fear, I guess maybe this is more of a comment than a question, and you can comment on it, that if we don't have some kind of accountability, like we would in a corporate world if people lost billions of dollars, we will continue to make the same mistakes.
I think the only way we're going to get accountability is in the courts of law. And we've seen that already. We're seeing lawsuits popping up, and I've been advising of some of them and holding people financially accountable. Long-term care centers that made bad decisions when the data was present, for example. But you're right, there are some bad actors out there pushing bad narratives who have been rewarded, mostly because there are people with deep pockets who are willing to reward them. I'm not going to name anybody. I think we can talk about that offline, and they're quite known on the global stage. There are famous epidemiologists driving national policies in various countries that were tragic, who were rewarded with better roles. But again, I got to have faith that lawsuits will get that work done. It's the larger point, I think, I take away from your comment is the message this sends to young people that there are no repercussions for bad actions as a whole. And it's a sad commentary on the moral state of our society. What a horrible way to end this conversation. But
one more little thing on that, a call out to media to look at what people have said in the past, whether it was accurate or not, and then decide whether those same people should be brought back on stage. Because I see the media as part of that cycle.
Yeah, someone has commented here, Alexander Maisonneuve, that Cochrane collaboration report on the mask is an example of people taking away the wrong message from a scientific paper. What the Cochrane collaboration review concluded was that there's insufficient information to make a conclusion about masks, but people took that as meaning masks don't work. And they ran with it, and bad actors ran with it. And what are the repercussions for individuals who deliberately ran with that bad information? Because a few of them we know who knew better, who made political points by misinterpreting and misrepresenting actual science. The question here is, do you think that publishers and authors should take a step back and think about the views in these articles? Yeah, I think so. I think it is definitely incumbent upon those of us who publish, especially those who publish papers that might be impactful on policy, to be clear about what our intentions are. I've been advocating that in addition to an abstract, a paper should have a couple sentences for the lay media that they can understand and run with, so that no one misrepresents what we're trying to say. Rebecca, you have a question there?
Hi, thank you so much for your excellent seminar today, Raywat. And as someone who's followed you, every day since the beginning of this pandemic, I just want to say that one of the things I appreciate about you is your optimism. And despite it all, you are fundamentally an optimistic person, I think. And I'd like to see if you have any parting thoughts that you might share with us to make us all a little bit more optimistic.
Look, there's a lot of good news here. Society did not crumble, right? We got to see where the cracks are. So once you see the cracks, we can fix the cracks. The pandemic isn't over, but there are coming tools that we will use to make it over, like mucosal vaccines. We saw the amazing rate at which vaccines were produced 4 years earlier than they should have been. That's a miracle. We can do that again. Just because some individuals ran with the wrong message that represented and tried to create more divisions doesn't mean we should give up on society. It means there's a lot more success than failures, frankly. And as many people as I saw being selfish and mean, I saw more people being caring and collaborative. So as a species, we tend to focus on the negative and ignore the vast amounts of positive. I got a lot of hate mail and threats. I got a lot more love, right? And it's easy to forget that. So there's a lot of love out there. We have to remember that and work to increase the love. Oh my God, I sound like some sort of guru, don't I? Increase the love, people. There's a lot of it out there. And the more you take, the more you leave behind. Isn't that magical?
That's wonderful. Thank you.
You're welcome. I think
Thanks
are we out
so
of time?
very much. Yes, thank you so very much. That was wonderful and a great discussion. Thanks everyone for joining. Have a very wonderful day.
Thank you all. I really
Thank
enjoyed
you,
being here.
Raywat.
Bye-bye.